Probably kind of nice to actually look at my materials. Play the intro loud up in here too. I want the people to be able to hear it.
Okay.
If you don't mind.
No problem. Yeah, one more song, Angie Stone and
all right, good. I can take a sip of coffee now.
Yo, cue up the ID and theme song.
Okay, cool.
Let's be next. This is 9:58 right now.
Thank you.
You're welcome.
Thank you for being here because I know you have a very busy schedule.
That should be at the church at 12. That's right downstairs.
Oh, okay. So you just a little early. See, now my first phone fell into the toilet like 2 days after I bought it. And I'm thinking I'm slick. I'm calling a manufacturing company, and they're like, "Okay, send it in, whatever. We'll see what we can do with it." They replaced it with a refurbished phone, right? I'm thinking this laptop is refurbished. I'm thinking refurbished things are a good deal for me. You know what I'm saying? It takes out substantial money. I bought this phone for $300. Right. This phone has a just in case I'm on the phone with you, it has a tendency to drop my microphone. But I can still hear you, but all of a sudden you can't hear me. It only does it on phone calls like past 30 minutes. That's when it starts acting up. And I have to call the person back, and sometimes it's not even possible. They have to go do things or whatever. So now I'm calling them again, like, they sent me a refurbished phone that had problems. This is the first time I've ever had problems with refurbished stuff. And they're playing games with me, you know what I'm saying? They're like, "Oh, well, you'll get an email saying this. I don't email, call back." So I'm cool, I get it, because I got over in the first place. I just spent another $100 to get another phone. But I just want one of them to tell me, "No, dude, no, we're not gonna give it to you." You know what I'm saying? Just tell me no. Don't give me the money around like, "Hey, call back at 5." So yeah.
Yeah, I have a pre-owned phone from Sprint, and they had a little glitch on the top. It's a Note phone. So other than that, it works fine. I just didn't want to pay the money for the brand new.
Yeah, I downloaded this book on Amazon, Audible, called Beyond Powerful Radio, and I listen to it every time I'm on my way here. Like tips, it's by a real powerful radio producer. She interviewed all the most powerful people on radio and talk radio and stuff. It's really interesting stuff, and it's the thing that taught me that phone calls are overrated. You know what I'm saying? Just because you get a lot of phone calls doesn't mean that you have a lot of listeners, and vice versa.
Oh, you have to be on the alert with some phone calls.
Yeah.
Because I learned from Al Sharpton. He gets some tacky phone calls sometimes.
Yeah, of course. Say,
Al Sharpton. Thank you for your call. Yeah. And that's how you phase out the call. Because you got to have a board operator know when to dump the call.
Yeah.
Because sometimes a phone call can take up too much time.
And it can be the low point.
It bring you down.
Yeah, exactly.
You try to maintain the pace.
Exactly. So 10:01. We fixed the connection for all those people. Something lucky. I should have been did this because this screen is actually better.
Eight seconds.
You're listening to WKND, 1480 AM, W248CR, 97.5 FM.
This is the Jamal Show. Jamal. This is the Jamal Show.
Okay. So we're ready to bring it down a little bit, little by little. Healthcare in America. Healthcare in America. Oh, I hear it now. Bring it down. There's a short in this one. Can you plug me into another one? Healthcare in America, people. We all need it. Universal healthcare. That's going to be my case today. Welcome to the Jamal Show. My name is Jamal C. Wright. Thanks for joining me this beautiful morning. It's a beautiful day to be alive. The weather's nice. It's not too hot. Nice and breezy. I enjoyed my way over here. I hope that you're all enjoying yourselves being alive today. We are all blessed. Welcome to the Jamal Show on WKND 97.5 FM, Hartford, and the surrounding counties. You need to turn up the intro. Yeah. I am Jamal C. Wright, your loving host. Thanks for being with us. If I may say so, you all look beautiful today. And I want to mention our sponsors for the show, the Hartford Smiles Dental Center on 11 Asylum Street, downtown Hartford, 4th floor. Make sure you give them a visit. Dr. Wilfred Sampson and Dr. Michael Green would very much appreciate you to come by and let them show you their nice new facilities, music included. On today's show, we are going to talk about universal health care just a little bit. Please don't forget that my views do not represent those of the station, as we are two separate entities. I also need to make an announcement that we will be accepting phone calls if you want to call in. 860-218-2173, 860-218-2174. You can talk to Jamal on the Jamal Show, and we'd love to have you, wouldn't we? In the studio with me, DJ Mackie C. I want to thank him for being here, helping me with the engineering. And if you hear anything that makes you happy or sad, call in. In addition, please like the Jamal Show on Facebook. You can find us based in Hartford, Connecticut, where we are heard in as many as 33 counties surrounding it. Our number is on the Facebook page as well. We post tons of interesting stuff, on the Jamal Show Facebook page, and we really could use your support. You can email us at jamalshowradio@gmail.com. Okay, folks, let's jump into universal health care in America. Now, when I was younger, I remember that when people got sick, they had to wait until it was actually bad enough to warrant going to the hospital. Nobody who didn't have health insurance already went to a private doctor for preventative care. Even when I was older, in 2014, when my mother died of brain cancer, this is a person that was middle class or above who could afford to take care of herself in general when she was working. But when you have an illness like that, a terminal illness, obviously you're not able to keep working and things start to fall apart. Now, if the illness wasn't critical or life-threatening in the hospital back in the day, they'd make you fill out paperwork before being seen. There's actually a skit at the end of Ice Cube's old album, it was called Death Certificate, where he gets shot and brought to the hospital, and nurses are trying to get him to fill out paperwork while he's bleeding out. It's actually an interesting skit. He dies at the end of the skit. Spoiler alert, if you weren't alive in 1996 and whenever it came out. This practice was a humiliating one for those who don't have health care in the hospital, in the waiting room, trying to prove to administrators that you can afford this place or that you should be given a chance to be seen and have care, and not have them send you to a clinic or have ambulances drive you around from hospital to hospital trying to find the one that has subsidies for you to get care. That's how it used to be. When doing some research on this topic of universal health care, I struggled with the subject of the title of the subject, actually, because I came to realize that there are many different variations of the plan to bring comprehensive health care to all American citizens. There are a lot of bells and whistles and minute details surrounding this issue, and it's very, very complex. In fact, one must be careful in making the distinction between health care and health insurance, because the two are not the same. Everybody needs health care by whatever means necessary. The human body requires maintenance, right? And even some people get hit by buses sometimes, right? I had a cousin in his early 40s die from cancer just last year. He was young and healthy all the way up until he wasn't. And he was young, again. Nobody could tell me they don't need health care. That would sound ridiculous because young people get sick and die just like older people. My grandmother, she passed away late last year, and she outlived like 3 of my close friends who all knew her. The preferred way to deliver this healthcare in America is through the use of insurance. I say preferred because most people who are covered get their insurance through employment. So they get this health care through insurance that comes through their employment, that's tied to their employment. And we're gonna get to that in a minute. But insurance is not the only way that health care can be delivered. And I'm not suggesting another way is better at this point, just that there are other ways it can be delivered to the masses. For example, America's active military is not under a health insurance plan. Rather, they are cared for directly by medical staff employed by the Department of Defense. The same can be said of the Veterans Health Administration that is provided for veterans of military directly. This is health care provided to them directly. Some rules about the corporate insurance model, some notes about it, in fact, and this is how insurance is connected to your employment. Most people get their health care this way, but in fact, the nation's reliance on the health insurance model, on this health insurance model, has caused increased administration costs. So in fact, 30% of U.S. healthcare costs are administrative costs because of this health insurance model. It's twice what Canada pays. About half of that is just in complexity of billing. For example, U.S. private doctors' offices need 7 people to do billing for every 10 physicians. The big reason is that there are so many types of insurance companies in the market, so many different players. And in addition to Medicare and Medicaid, you have like 1,000 other different private insurers. Each has its own requirements, forms, procedures, practices. Hospitals and doctors must also chase down people who don't pay their portion of the bill. That doesn't happen in countries with universal health care, by the way. And I think you can see where I'm going with this. The reliance on corporate private insurance has also created healthcare inequality. Before Obamacare, those without insurance often couldn't avoid visits to a primary care physician. I talked about that earlier when I told you about when I was younger, how it used to be. When you go to the hospital and fill out paperwork before you're seen. By 2009, half the people in America, or about 46% of them, who used the hospital said they went there because they had no other place to go for health care. The Affordable Care Act was signed in 2010, by the way. We must also acknowledge that all medical treatment is not equal. That's very, very important to know. All medical treatment is not equal. There is preventative care and there's emergency care. We can group them in those 2 categories. Emergency care brings the most expensive and the least helpful care to the person. Emergency care is where people who cannot afford preventative care end up. And it is true that most people will die from an illness that they could have prevented. So preventative care is the most important of the 2. Now, in discussing healthcare in America, we must also distinguish healthcare as something that is not your ordinary good or service. Healthcare cannot be compared to a good pair of socks that you buy at Walmart. It's not optional. As I mentioned before, everybody needs or will need healthcare. Whether or not they say they need it or not, and that healthcare that they need will cost money. Now, things that people need are usually highly regulated. Think of energy, for example. Your energy company is highly regulated. They can't just turn off your electricity without taking certain steps, even if you owe them money. Your water is regulated the same way. These are necessities, aren't they? Health insurance companies are regulated too, in fact. Some would say not enough based on anecdotes. You know, we always hear about people who are terminally ill being neglected by insurance companies. I believe Barack Obama, one of the reasons why he signed the Affordable Care Act was he described his mother being very, very sick, very, very ill, having health insurance, and still having to argue with health insurance companies on the phone while she was sick. He remembers that as a child. It's something that he took with him, that he carried with him until his adulthood, all the way up until he signed the Affordable Care Act. Shout out to Nancy Pelosi, by the way. She was very instrumental in passing that. So healthcare is not your ordinary good or service. Although some medical specialists like dentists and plastic surgeons are actually treated as free market services. So in other words, you can go into your dental office and pay $40 or $39.99 for a teeth cleaning, like you can at Hartford Smiles Dental Center. Ding. Hartford Smiles Dental Center with Dr. Wilfred Sampson and Dr. Michael Green, in fact. That's how much they charge. You can go into a dentist, it's a free market thing. Theirs happens to be cheaper than everyone else's, so they get promoted on the Jamal Show. See how that works? Now, we must also acknowledge in our discussion of healthcare, let me get back to that, how much the cost of healthcare is prone to rising substantially. And this is the real issue, folks, right? This must be part of the discussion because healthcare is a need that is generally priced out of reach of the overwhelming majority of Americans. Most people don't carry enough money in their bank accounts for an emergency heart surgery, right? I've heard recent statistics that said most Americans can't spend $500 without planning for it. Most people don't have money for cancer chemotherapy in their wallets. A long hospital stay can easily surpass the spending limits on just about any credit card. Here are some facts. In 2017, U.S. healthcare costs were $3.5 trillion. That makes healthcare one of the country's largest industries. It equals 18%, just under 18% of gross domestic product. In comparison, healthcare costs $27.2 billion in 1960, and it was just 5% of GDP. This translates to an annual healthcare cost of over $10,000 per person in 2017 versus just $146 per person in 1960. And the real problem is that healthcare costs have been rising faster than the average income, hasn't it? Isn't that the real problem, that it's been rising faster than your income has? Healthcare consumed 4% of the American's income, of an American's income in 1960, compared to 6% in 2013. It's like the rule of relativity. Something is advancing faster than something else. That means it's moving away from you, and healthcare is moving away from most Americans from being something that was ever affordable. It wasn't affordable in the first place, and the real issue is the rise, the gradual rise of its cost, sometimes in the double digits. There are many causes for this increase in healthcare costs, actually, but we can group the causes for simplicity into two categories: government policy and lifestyle causes. But before I get into that, very, very important information. Before I get into that, I think I want to take a break. I'd like to see you on the other side. On this break, I'm going to play a song that I grew up to, kind of. My grandmother used to play it in my house. Chuck Mangione, Feels So Good. I think it's one of the only trumpet players that was #1. I actually won a Grammy for this. This came out in '77. I was 6 years old, giving away my age. Hit it, my man. You can tell I haven't had a sleep.
That's a big time hit. I remember this.
You look like I'm going too fast, dude. Okay, slow down.
It was good you took a break because you break your show into segments.
Yeah, and I've learned to do one set. I'm trying to switch to do one subject to show now. I want it to be memorable, and I want it to be more viral and inspiring. God look to it. It things like memories of my childhood.
Myself too. Yeah, I was trying to cross connect your live feed back to the radio station. Looking for
What? So what?
You on Facebook Live?
Yeah, I am. It's on. It's not on my page anymore. It's straight to Jamal Show, the Jamal Show page now. I found a way to do it. You can do that from the laptop. You can't do it from the phone. So I'm trying to give people a reason to go to that Facebook page.
Right.
See it on that page? Have you look? Yeah, see, there you go. I love this song. Good music. All right, people. I know you want to thank me. You're welcome. You're welcome. Too bad you didn't have your tape deck ready for that. Back to the lesson at hand. What's the problem? Healthcare is rising. Rising real fast, rising faster than your annual income is. There are many causes for this increase in healthcare costs, but we can group the causes of this increase in healthcare to two categories, as I said before the break, and now I'm saying again after the break. The two categories are government policy and lifestyle causes. Now, government policy since the 60s has been slowly to expand government-sponsored medical programs. Expanded programs have caused more people over time to get into the marketplace, and this has pushed up demand. And demand always, when there's a limited supply, demand always pushes up the cost. So that's led to an increased price. So the very act of government providing or expanding healthcare for people tends to bring up cost in the industry because it increases the demand. More people come to the market through the pathways that government has laid down. Between 1960 and 65, healthcare spending increased by an average of 8.9% a year. That's because healthcare insurance expanded. As it covered more people, the demand for healthcare insurance rose. You get the theme here, is what I'm saying. You get the theme, right? So from 66 to 73, healthcare spending rose by an average of 11.9% a year. Medicare and Medicaid covered more people and allowed them to use more healthcare services. Medicaid allowed senior citizens to move into expensive nursing home facilities. As demand increased, so did prices, as I explained before. In 1973, Nixon completely abandoned the gold standard. That's when some of you young folk might not remember that our dollar bill used to be based on gold in Fort Knox. Now, we still possess gold. We hold gold for other countries. I used to work for the Federal Reserve Bank many years ago, and they actually showed me the gold that they have in the basement. You have to wear these like iron shoes and stuff. So we still hold gold for other countries that use it to trade like pharmaceuticals and stuff like that across country borders. But Nixon, and probably was a smart move to try to save our budget, abandoned the gold standard in 73. As the dollar's value plummeted recently after that, as soon as that happened, the dollar's value plummeted because people didn't know about the fiat system. They didn't know that a dollar could still be worth something just because we said it was. It unleashed double-digit inflation, and healthcare costs rose at the same rate. From 74 to 82, healthcare prices rose by an average of 14.1% a year for a few reasons. First, prices rebounded after the wage price controls expired in 1974. I didn't mention those, but there were actually some price controls input by Congress. Also, the home healthcare craze took off, growing about 32% a year. So there was something driving, this 14% increase. But you'll find that almost every year there was something driving it. Between 83 and 92, healthcare costs rose by an average of about 10% each year, which is still a lot. Less than 14, but still a lot. Now, particularly in 1986, people, this is why you can go. This is how you can go into any hospital and be seen. They won't throw you out. In 1986, Congress passed the Emergency Medical Treatment and Active Labor Act, and it required hospitals to treat anyone who showed up in the emergency room. Anybody. Doesn't matter how you look, what you sound like, what you're wearing, or how you smell. They have to take you. These uninsured patients costed hospitals about $10 billion a year back then when they started implementing this program. Most of the hospitals passed it on to Medicaid, except the ones that are charitable ones, that raise money outside of Medicaid. Emergency rooms are the worst way to treat illness, people, because it relies on chronic symptoms to appear before a person seeks treatment. And it's also very, very expensive. Between 1993 and 2010, healthcare costs rose by an average of 6.4% a year. And this was because in the early 1990s, health insurance companies tried to control costs a little bit by spreading the use of HMOs. So this came out to be popular in the late 90s, which is what they call, HMOs are what they call health management organizations. Blue Cross, Blue Shield, Kaiser Permanente. Interesting tidbit, Blue Cross was started by a bunch of hospitals in Texas. And what happened was doctors didn't like hospitals having, it was kind of a cooperative agreement between the hospitals where people could pay a monthly fee and still get seen at one of these hospitals that kind of like joined in the circle or what have you. And doctors didn't like the hospitals had all this power and control of who they were seeing. So they created their own organization called Blue Shield soon after in another state, which I forget. I'm just kind of riffing. But this is all true. You can check it out. And then in 1982, all the way in 1982, like I was already alive. So this seems, I guess it was a long time ago. They actually merged into Blue Cross Blue Shield. So that's one of those things how goes to show you how opposition can sometimes become their closest ally. After 1998, people rebelled and demanded more choice in providers, and as demand increased again, so did prices. So between 1997 and 2007, drug prices actually tripled. By 2009, rising healthcare costs were consuming the federal budget. Consuming. Medicare and Medicaid costed over $600 billion, and that's 19% of the total budget at the time of 3.5 trillion, excuse me. Federal healthcare costs are a part of the mandatory budget. Just a little lesson here. That means they must be paid. As a result, they're eating up funding that could have gone to what's called discretionary budget items, such as defense, education, and rebuilding infrastructure. These are the things that Congress actually brings up and down every year is discretionary spending. There are some things that they have to spend on. Social Security. Your grandmother doesn't get that check. You and everybody else in the family will be getting a phone call, plus the government. So yeah, that's mandatory spending. There's mandatory spending, there's discretionary spending, and then there's the interest rate payments that the government has to make. There's three things. So most people, when it comes to controlling government spending, they focus on the discretionary spending because that's the easiest stuff to like. You can lower your discretionary spending without making a law to lower it, right? But if you want to cut Social Security, you got to come with a law. And being that seniors are the biggest, strongest voting bloc in America that America's ever seen, I don't think you're going to be able to do that. But that's just advice from me. So we're talking about discretionary spending. And these federal healthcare costs are cutting into discretionary spending because they add to mandatory spending. Now, a quick thing about Obamacare, really quickly. Obamacare's goal was to reduce overall cost of healthcare as a budgetary item in general. First, it did this by two ways. First, it required insurance companies to provide preventative care for free. You know, this is why your checkups at the doctor are generally free. And in this way, it treats chronic conditions before they require expensive hospital emergency treatments. So it also reduces payments to some insurers. That's part two. So in other words, you know, insurance decided to go up on, you know, what things cost. You know, Medicare is like, does that make sense? I don't think it makes sense, so we're not going to pay more. That's kind of what Obamacare allowed Medicare to do and allowed insurers to do. So in 2010, when the Affordable Care Act was signed, healthcare costs rose by 4.3% that year. So it did achieve that goal of lowering the growth rate of healthcare spending. You know, I think the year before was like 6.5%. So when Obamacare was implemented, it immediately lowered healthcare spending 2%, 2 points, which is good because 2 points in $1 trillion budget is a lot of money. So Obamacare succeeded in a few ways, actually. It expanded healthcare to millions of people who are not getting preventative care. And secondly, it slowed the growth rate of medical costs. So the people who say Obamacare is a disaster don't know what they're talking about, basically. It also covered millions of people specifically with pre-existing conditions, which is a big deal, since most of us have some kind of pre-existing condition, even if it's not detected yet. Obama also stopped insurance companies from charging women more just because they're women, which seems like a novel idea from my point of view, particularly since women are the majority of American citizens. Now, I named one aspect of why healthcare costs go up. I named government. The way the government has expanded healthcare has increased demand, thereby making it more expensive. People have to pay more for it. But there's another thing, the American lifestyle. The American lifestyle is another cause of rapid increase in healthcare costs. Now, let's talk about this. The 4 leading causes of death are heart disease, cancer, chronic obstructive pulmonary disorder, and then stroke. Chronic health conditions cause most of these diseases. They can either be prevented or would cost less if caught in time. In other words, they can be prevented if caught in time is what I meant to say. Or you can wait until they're chronic and the symptoms are terrible and then you go to the emergency room. But everyone knows it's too far along at that point where you don't really have a chance anymore, do you? Now, I call these lifestyle causes of healthcare going up because a lot of these things are preventable. Smoking is a risk factor for lung cancer and also for COPD. Obesity is a risk factor for other common causes of cancer. So, you know, there are things you can do. Your body requires maintenance. That's the moral of the story, people. Your body requires maintenance, whether that be having a regular exercise schedule or seeing a doctor regularly. And your maintenance is considered part of preventative care. If you do nothing and then wait till your chest falls in one day and then run to an emergency room, that's not preventative care. Recent research has found that even Alzheimer's disease might be preventable. These diseases cost an extra $8,000 per person per year, and it's 5 times more than the healthcare cost for a healthy person. The average cost, of treating diabetes, for example, is about $27,000 per family per year. These diseases are difficult to manage because patients get tired of taking various medications. Those who cut back find themselves in the emergency room with heart attacks, strokes, and other complications. So this is a very important issue. And I'm headed somewhere here. The case I'm going to be making is for universal health care, whatever you call it. Medicare for all, nationalized health care. But in order to get to that point, let's talk a little bit about how health insurance got bundled with employment in the first place. It seems like people's health care being tied to employment is natural in a capitalistic society like America. But the history of most Americans getting health insurance through their jobs really begins with World War II. In 1942, with so many people being diverted to military service, the nation was facing a severe labor shortage. Economists feared that businesses would keep raising salaries to compete for workers, and that inflation would spiral out of control. And the nation had just come out of a depression recently, so the last thing they wanted was instability. So to prevent this, President Roosevelt, those historians may recognize that name, signed Executive Order 9250, establishing the Office of Economic Stabilization, which is a really long sentence for they froze wages. They froze wages as a result of intense competition between companies trying to get the very few workers that were left over. But businesses were smart. They got around this. How did they get around it? They began to use luxury benefits like healthcare to compete against each other. So like you'll get the luxury healthcare plan. You'll never have to worry about paying a dime. I gotta pay you what the next guy's paying you, but I can really give you good healthcare. So employers got really generous with healthcare insurance, and that's how healthcare got tied to employment in America. Then, to reinforce this, in 1943, the IRS decided that employer-based healthcare should be exempt from taxation. So this made it cheaper to get healthcare insurance through your job than by any other means. If you got it through your job, then it was tax-free. If you try to get it on your own, it's not tax-free at the time. Some of the countries have employed these employer-based programs, but not to the extent that we have here in America. Some negative aspects of this employer-based program, let me go through a few of them. One effect is job lock. People become dependent on their employment for their health insurance. We all know people like this who are out of job because they get good benefits, right? Or they're paying very little for their benefits, right? They have kids that need benefits, right? This is one of the reasons why states have started a move, even some moderate states have started a move to at least give children free health care statewide if they couldn't do it nationally. Many people are very loath to leave their jobs, even when doing so may make their lives better. They're afraid that market exchange coverage may not be as good as what they say, as what they have already, and they're most likely right about that. They're afraid that if they retire, Medicare won't be as good. They're most likely right about that as well. They're afraid that if the Affordable Care Act were repealed, they might not be able to find affordable insurance at all, which is a very, very valid scare. People say we cannot afford universal health care, but they ignore how expensive employer-sponsored health care is to the American budget. People don't think about that it's actually tax-free. So employer-based healthcare being tax-free means that the single largest tax expenditure in the United States is for employer-based healthcare insurance. It's even more than the mortgage interest deduction. In 2017, the employer-based healthcare insurance deduction was about $260 billion in lost income and payroll taxes to the American government's revenue. This is significantly more than the cost of the entire Affordable Care Act each year. So there is a cost to employer-based health care. The system also induces people to spend more money on health insurance than other things. This increases overall healthcare spending, and it brings the employers to pay you less in actual salary. So spending on healthcare insurance premiums have increased sharply in the last 15 years. but wages have not. Wonder why? The employer must increase his spending on your health insurance, but giving you a wage increase is discretionary. So he can decide to or decide not to every year. You know, what's your business in it? We will see what each Democratic candidate says, but as for me, I'm for universal health care. I'm making the case for universal health care, people. And I think I'm going to continue this case after my next break. Your ears need a rest. We're going to go ahead and play this song for you. I'm going to come on the other side and tell you why universal health care is what you need. Hit me. Yeah, I love this song. I can't stop playing it. Yeah.
One thing I remember that this song came out in '81. This song came out the day Reagan got shot.
Oh, really?
Yeah. It was playing on the radio when he got shot.
And the beauty of it all, when the sun comes shining through, you make no rainbow in my mind. When I think of you sometimes, and I want to spend some time with you. Just the two of us. We can make it if we try. Just the two of us. Feeling better in the sky. Just the two of us. You and I. We look for love, no time for cheer. We should follow all that is. And it don't make no flowers.
Good things must come to those who wait, not to those who wait too late. Love that part.
And then this, a couple of months later, Bob Marley died.
Yeah, that was in '77, right?
Early 80s.
Oh, I thought he died in the '70s. Okay.
He had cancer.
Yeah, that's right. He didn't want to go to a doctor at first, and then when he did go to the doctor, it was too late. Just the two of us. See, part of the reason why I was going a little faster is because I had so much material. You know, I mean, healthcare is just a big topic. I was going to try to do more topics, but I was like, man, this is such a big topic. I probably wouldn't be able to cover it all with what I have. With what I have.
Yeah, you can break it up. You know, you have your segments.
Yeah.
So
When I feel like I'm going too long, that's what I use the music for, you know, to try to reset the listener's ears, because after a while it just becomes the guy talking, blah, 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 blah. You know what I'm saying? So I figure, break it in. I'm trying to leave teasers now, too.
call in.
Yeah. Well, I'm not. Be honest with you, whether people call in is up to them. I have so much stuff today that I could actually easily get through without that. But teasers so people stay through the song, you know, like, oh, when I come back, I'll be talking about this. Also gives my voice a chance to rest. You and I. Oh, every time I post on Facebook, they try to kick off the posting because of the music.
Oh yeah.
But because the radio station, y'all pay for a license.
Do, but you know, you have to say, the also was not owned the copyright.
Right, exactly. Stop it. There we go. We almost went into one of my other favorite songs, but we don't have time for that today. Because I'm going to talk to you about why universal health care is so important. It's got to be on the menu, folks. I love Joe Biden, but I love Bernie. We already know what Bernie stands. I love Joe Biden, but I love him a little bit less if he's not on this bandwagon of universal health care, because it affects so many different things. We'll see what each Democratic candidate says. But as for me, I'm for universal health care, as I said. This idea of providing health care to every American citizen has been termed in many different ways, though. And since President Truman came up with the idea in 1945, what's up, Truman? Truman is the guy who came up with it. when he first tried to push it. But when he pushed it, people on both sides didn't like it. The unions didn't like it. You would think the unions would be all for that now, but back then the unions didn't like it because they spent all this time negotiating for healthcare benefits. Now everyone's gonna get it. That shows less value that they're providing to their members, right? Of course, businesses didn't like it. They wanted to be able to give perks via healthcare for employment. There are actually several bills in Congress right now on how to expand healthcare to everybody. And I want to talk about a couple of them really quickly because they do differ. When you talk about nationalized healthcare or universal healthcare, however you want to term it, there's just generally there are three bills that people are expressing in Congress right now that people are putting forward. I don't know which one is going to win or if any of them are going to get signed, but especially with this guy in office, crime boss Trump, who knows? He'll probably sign a bill to have us all killed before he cares. In any case, Medicare for All is one of them. Single national health insurance program for all U.S. residents. Now, a couple of notes about this. This was made popular by Bernie Sanders, even though it's been proposed by many people before, including those on the right side, what they call the right. I suspect that Bernie uses these terms Medicare for All because of their simplicity. This implies the expansion of a program that is already tremendously popular with citizens, Medicare. So it's not as popular in the sense that there are no complaints. Everyone complains about their health care, but even from health care that they pay for. But it's very popular in that many seniors enroll in it every year. As I understand it, though, Medicare for All would prohibit any private insurance companies from offering any insurance that can compete with the expanded Medicare program. In other words, the only private insurance you can get is for things like elective surgery or specialized services. So Medicare for All effectively eliminates the private insurance market, at least for basic services. And that's something I'm not as keen on. I'm sure amendments can be made. A second bill idea is being called forth in Congress is nationalizing health care with an opt-out for those who want private coverage. Now, this is a great idea. So in other words, you're already born with health care. You have a right to health care as you're born. And if you ever feel the need to go above and beyond, you can just opt out of the nationalized health care and get whatever you want and pay for it. I don't see what a private, capitalist would have with that idea. It's kind of a Medicare problem, a Medicare for All program that people can opt out of. Now, as I understand it, this plan would not eliminate private insurers from offering competing coverage on the national plan. A third idea is a new public option. We've heard that before, right? When Obamacare was being pushed through Congress, everyone was like, hey, why don't we put a public option in so that people can choose the public option instead of having to pay? Well, that's still in a bill in Congress right now being pushed forth by a few congressmen that I won't name because that'll bore you. But it doesn't matter where the idea comes from. It matters how good the idea is. This public option plan would be offered to individuals through the ACA. And this would make it's like a national plan that's part of the offering along with the other private plans in the marketplace. So this public option would be a plan in which people would have to opt in as opposed to opting out. You can buy, you're at a place where you can buy insurance if you want, or you can just opt into this free plan that's provided for you and for every American to have health insurance. Now, for some silly reason, if you don't want health insurance at all, which I have no idea why anybody be in that position. Even babies have life insurance, right? That makes sense. So if you were a silly person on earth that didn't want health insurance at all, you don't have to opt in at all. You can just walk around without health insurance. Needless to say, we are the only industrialized country not to mandate all of our citizens be covered by some type of health care. And we pay more than every other country for equal or lesser results. I encourage everybody to watch this movie. I'm a big Michael Moore fan. You'll find that out. Michael Moore is a movie director who does mostly documentaries. Been a fan of his since I was in college many years ago. And he did this movie called Sicko. It's a great movie. pretty much examines how things cost less in different places. Pharmaceuticals charge what they believe they can get. So, you know, things here, you might pay $18 a pill here and pay 5 cents a pill in Mexico. Literally, he took cameras and did things like that. So I do advise that moving for people that are interested in this subject and how healthcare works and why so much of their money is going towards past bills that their insurance company refused to pay and why they refuse to pay it. Some would say that government should have no role in healthcare. I absolutely disagree. My ideal is for universal healthcare, and here is my argument. We already pay for it. Every budget is a list of priorities. The things at the top of the list are those that we consider to be the most important things. Just like you, when you're doing your grocery list, you buy the most important things first. So we find money for those things. You know, your family likes chicken wings, you make sure that you have the chicken wings first in the basket. If the chicken wings cost more than everything else, then there's something else that's going to be taken off the list. That's why America has never met an aircraft carrier or a jet fight plane that America couldn't afford. They made sure it was called a priority. They made sure the money was there for it. And as such, if you look at the American history or the history of American healthcare, as it's rolled in a budget, a large part of our budget has really just gone to defending us in another way. For fiscal year 2020, Trump is asking for $989 billion for defense on a whole. That's like 60% of the discretionary budget. Probably more of the discretionary spending budget than 60%. I don't have a problem with that. I don't have a problem with spending money on defense. I am not making the argument that we don't need weapons to fight the potential enemy. I'm arguing that our war has changed. Our enemy is no longer the Germans or the Japanese. Our enemy is disease. Disease is what stops us from working, increasing tax revenue. Disease brings us to the point where we become counterproductive members of society. It turns us, it brings us to a place where we become a burden on our brothers and sisters. If you can hear the sound of my voice right now, it is most likely that you will die, sir or ma'am, from an undetected illness or an illness that was caught too late. Most likely something that could have been prevented. That's how you'll die. Had you had the information earlier, you might have extended the quality or the length of your life. You will most likely not be killed by a bayonet of a foreign soldier. You will most likely not be beheaded by some ISIS warlord. You will most likely die of some preventable illness. You will perish from the type of malady that cannot be fought with a warplane or an aircraft carrier. It will be an illness that makes you suffer in ways that make you wish for death. And when you're suffering, while you're in your suffering, the idea of extra-military on the Canary Islands may not provide you comfort. It is incumbent upon the government to protect its citizens. They have defended us with military. But there will probably never be another world war. Currently, we need protection from disease, for that is what's killing and maiming Americans today. Illness is what restricts our freedom now, not Hitler. It is in the best interest of this American government to keep its tax-paying and potential tax-paying citizens alive for as long as possible. If government cannot do that, it cannot help me fight for my life. It cannot help me extend the quality or the length of my life. Then what is government good for? Universal health care is endorsed by the Jamal Show. Let's take a break. Why don't you play something for me right quick? DJ Mackie C, I got to calm down. I hope you get this message. God bless. I always tell them that this is a hit. But in a couple of weeks, I'm going to show you something else that I think is a hit too. Okay. And he's a hard worker. He'll come up there and want to sell too. So what I was thinking, I was talking to this guy. because I really like comedy. I've been to every comedy club in New York City. I'm talking to this other guy that's interested in comedy. He has somebody. I'm talking about doing a comedy show there. And any place that will have promoters. I don't think the Funny Bone does have promoters, but and maybe having him open for it. Because I can get them that's free and safe.
Have you been to Bible before?
No, I haven't been as many folks out and stuff out here. Really, there's one by my house, one piece or something like that, that I've been like a black one in my house. Near Farmington, Piggies.
Oh yeah.
Yeah, I've been to Piggies, a couple other ones, but I didn't go big ones.
It's real good. It's a restaurant and lounge downtown by my job. It's called Cibola 153.
Cibola 153 in Hartford?
Cibola 153.
Here in Hartford.
Yeah. Black owner outfit.
I'm gonna check that out.
Yeah, the owner, he's Haitian.
And we can talk to him too.
Yeah, he's a good friend of mine.
All right. So I'm gonna check that out.
So he does like an open mic comedy on Monday nights.
That's great. Okay.
But
I was thinking about maybe getting some, actually have a name though, because I'm from New York City. I get in contact with them.
something like the Jamal Show presents.
Yeah, that's actually a good idea. That's a good idea.
I can back you up and do the radio.
That's a good idea. Yeah, Tommy was really impressed by the fact that you played the songs off of my show and stuff like that. So I told him I really liked it, and he's really thankful for that. He's really excited about that.
Yeah, let's get back to, you introduced me to him. So.
Okay. Yeah, definitely. Okay.
I'm gonna know I'm a bishop, but I'm outside the box.
Right.
Box in.
I understand where you're coming from. I
can relate to what he's saying,
Yeah, and he's very family oriented. That's another thing I love. He's very positive. You know what I'm saying? Like, I've seen him discipline his kids before, and he puts it all into being a father. And I think audience of hip hop needs to see that kind of stuff. Right? Like, not just talking about bitches and hoes and stuff, but yo, my child is important to me. Stuff like that. All right, I'm gonna come in and basically say goodbye. Okay. But take about 5 minutes to do it. Hey people, this is the Jamal Show, WKND 97.5 FM, 1480 AM. You choose. A minute. I had to pick up my research. I never approached the mic without research done, so I can tell you people the truth, unlike the president. And let me tell you, we need universal health care. For all the above reasons, I will be posting this episode online if you want to listen to it again. There were some other hot topics, but none of that stuff is as important as healthcare in America. Just imagine how many people would leave their jobs and start that startup business if they didn't need to keep healthcare for little Timmy. They would have a lot less restriction. They'd be like, okay, I saved up some money and my healthcare is good. And employers can stop suckering you by not putting, they put more money in the healthcare expenditure. They get a deal on that side. And they figure they don't have to give you more money and wages, which is really what the issue is these days, right? That's what's causing the split between the rich and the poor. Speaking of healthcare, I got to give a shout out to Bill de Blasio. Even though I desperately do not want him to run for president, I am a New Yorker, and the poll says that 70% of New Yorkers don't want him to run for president, and I would be one of them. Actually, I'm not a New Yorker anymore. I'm from Connecticut now, I guess. I have adopted state. But I'm from New York, so I know Bill de Blasio very well. I've actually been in front of him a few times, consulting for my family church. Nice guy. He's going to be the number 23rd or the 24th person to run. I can't count. I can't keep track of them all. I'm going to tell you straight up, this dude's like 10 feet taller. So he definitely beats Donald Trump in height. I mean, this dude is like a ball player, man. When he walks, like, you can see his suit like swinging off him like a pole. He's known Trump for years, and he says he can handle Trump. He's actually the mayor of Trump's hometown, of course. Now, some things that people don't know about him on the national stage is really interesting that we've also found interesting in New York is that he's married to a very politically, try to say that 3 times, very politically active ex-lesbian black woman and she will actually describe herself as an ex-lesbian. So don't write the hate mail to me, folks. So he has 2 black children, and these children are like, you know, hellraisers, right? Like, apparently the daughter likes to smoke a lot of pot, and she doesn't really care if cops are around. And his son, I love it. His son has the most beautiful afro. I don't know if he still wears it, but his son used to walk around with an afro. And then years ago, he got accosted by cops, like in some, you resemble the suspect stuff that they always pull. You know, you resemble the suspect. Your car resembles the vehicle, whatever they pull. So he was actually stopped, and there was some kind of incident. And this mayor de Blasio came out, and he actually dissed the cops. He was like, yo, man, that's my son. They basically, you know, I paraphrase, so don't go like writing letters about this. You know what I'm saying? And the cops like turned their backs on him at the next funeral. Like, they wasn't feeling that. But, you know, what's the man supposed to do? That's my son, you know? What's up? Now, de Blasio actually has, I have no faith in him winning the Democratic election. Nobody from New York thinks that he's going to win. Just like nobody from New York thought Trump was going to win. Most people feel like he's just trying to get some light because he's so progressive. He is. He's got some good numbers in New York. He's got free pre-K for everybody in the state. New York, I mean, this is more Governor Cuomo, but New York also has free college. All state colleges in New York are free now. All city colleges in New York are free now for people that graduate college, for people that graduate high school. So this happened under de Blasio, even though it was Bloomberg was for it too. And so everyone feels those numbers, but his personality is not really, you know, he's not a people person, so to speak. So anyway, I just had to riff a little bit about my mayor. We're gonna have to end this show. This is a healthcare show. I hope you got something out of it. I really want you to join us next week on the Jamal Show. Thanks for being with us. We'll be here from 10 to 11 next week. We're probably gonna talk about abortion. Let's go.
This is the Jamal Show.
I think that was good.
Jamal Show.
Oh yeah.
This is the Jamal Show.